Utah health officials say the state is starting to turn a corner on the Omicron surge in some of the more populated areas of the state. However, they say don't go throwing your mask out just yet.
It's certainly still huge numbers of cases, but we are seeing less than what we were seeing before.
January has been a harrowing month for COVID-19 in Utah. Record-breaking numbers of daily infections, with numbers toppling over 10,000 daily cases, all thanks to Omicron. While the Utah Department of Health reports numbers that high have begun to fall in some of the more populated areas of the state, doctors say they're still caring for an alarming number of patients in the ICU. According to Intermountain Healthcare, those who are not fully vaccinated make up about 82% of patients in intensive care due to COVID. Now, you may remember just a few weeks ago when state health officials encouraged people who were experiencing symptoms not to get tested due to a backlog of tests. State epidemiologist Dr. Leisha Nolan says they have other ways to determine state trends beyond the absolute testing numbers.
So we have systems where we monitor how much COVID is in the wastewater, and that's going down in most parts of the state now. So I think we have turned the corner, but I don't want people to think that means, oh, now it's completely safe to go out. We still have a lot of transmission in the state.
And Dr. Nolan says while there are areas of the state with smaller populations, the risk of becoming infected remains. And that's why she says vaccination is still important, especially as doctors continue to learn more about the Omicron subvariant, BA.2.
And I think, unfortunately, that's not the only threat, right? There could be a different mutation somewhere that we haven't even realized yet.
Now, regarding testing, Dr. Nolan says the state is starting to receive more tests, and they may look at reevaluating their recommendations for those who are experiencing symptoms in regards to getting tested. In Salt Lake City, Curtis Booker, ABC 4 News.
Thank you, Curtis. Now to looking at Utah's COVID case